question on that before we proceed to today's task? All right, great. So it means that we are following what is we did yesterday. I hope everybody took their quizzes that they were supposed to. It's very helpful if you do that. I think you get to know whether you are on course or not. Okay, so everybody do well to do the quizzes, and if you have any challenge, that is where you will see whether you are struggling or you are actually following what is going on. Okay, so find time if you haven't started and do the quizzes. That way, you help yourself and help all of us. All right. So today, Data, you okay?
Can you see my screen?
Yeah, I can see your screen. Okay, good.
Okay, good.
Now I can see it. So we want to look at regulations and standards in STAR or Central STAR. Regulations and standard. Just a layman's understanding. When you say regulation, what does that mean?
Rules.
Rules. Yes, somebody says rules. Yes. I think we have how many of us on the line on the
Things that are
platform?
set in place to follow.
Could you say that again? Sorry. The
Things
first
that
part.
are things that are set in place to follow.
Things that are set in place to follow. You guys are doing awesome. Let's take two more ideas and then we can.
Yeah, it's a rule or regulation that controls or governs a conduct.
Rules or regulation governing a conduct. Maybe one more.
Rules issued by administrative agencies.
Okay, rules administered by regulative what agencies. Okay, all of you did well. Nobody's answer is far from wrong. No. So that take me to the next slide. Let's see. So we are expected that by the time we'll be done with this topic, we should be able to explain the difference between regulations, voluntary standards, and regulatory what standards. Okay. We should. All right. Provide basic information about the U.S. Food and Drug Administration and other government regulatory what agencies. We should also, by the end of these lessons, be able to explain the roles and responsibilities of regulatory agencies that impact how Central STAR Department functions. And lastly, but not the least, discuss how organizations and associations that develop regulations and standards affect STAR or Central Service. So by the time we'll be done, you will know which entities, which agencies can make laws or regulations or rules for us of have facilities to follow. And if they don't, we will see whether there are any penalties or any fines that come with it. All right. If there's a rule and the rule is broken, what happens? Punishment follows, right? And then, as we saw in the first objective, that you will be able to differentiate between voluntary and so it means some of the standards or regulations are voluntary. Okay, they are not binding on us or the health facility, but it is recommended that they follow the standards stipulated or outlined by these agencies so that they will be in conformity, or they will provide better healthcare services for their patients that come in. Statutes, regulations, and voluntary standards impact every healthcare professional, those working in, and including those working in central service. So once you step into the hospital setting and you are hired after this course, if you are privileged, which we are praying that every one of you on this in this class will get opportunity to work in a healthcare facility. Once you step in, you will begin to see these statutes as you go through training, as you get in services at your departmental level, and as the hospital prepare to receive visitors from outside, you go through these statutes, these regulations, this standard. That is where it will make a lot of meaning to you. But for the purposes of this exam, we need to know them. But when you enter into the job market, it makes it a little bit practical. So these laws and guidelines establish minimum levels of quality and safety. When these laws and guidelines are not followed, the results can vary from legal consequences to poor patient outcomes. Yes, if you violate a law, you have to pay a price. Okay. The rule, if you are hired and you have a shift, your shift is 3 to 11. If you come every day late, what happens? You'll get disciplinary action, right? You'll be written up. You can lose your job, okay, or you can get pay cut. All of those are levels of what punishment or disciplinary actions that comes with it. So standards, regulations, standards are there to make sure that workflow is done in an organized and safe way. But if for any reason any of the regulations are broken, depending on how legally binding they are, it could attract a legal or a fine or a punishment for that matter. The next, okay, what we have is a voluntary standards versus statutes. Voluntary standard versus statutes. That is what you have on your screen. I say standards are either regulatory or voluntary. Standards are either regulatory or voluntary. Regulatory standards are enforced by government and have legal consequences if violated. Regulatory means that most of the time they are instituted by the federal government, and those ones are enforceable. They are punishable. They become a law binding on you. Just like, for example, those of us, if you have a lot of us that are on this platform that drive, you cannot drive through a red light. It's a law. If you drive through a red light, what happens? If the police officer is there, the law enforcement officer is there, you get a ticket. Sometimes the law enforcement is not even there, but the camera, there's a guy who is hanging top there who will take your license plate and then your driver's the car plate, and then they will mail you your fine. Sometimes it attracts points, sometimes you go to the court, or sometimes you pay a fine and then you go. Whatever way, there's some level of what discipline. So regulatory the regulatory ones standards are enforced and have legal consequences on if you break them. But versus voluntary, the voluntary standards are recommended for better patient care, but are not legally required. So it's voluntary. But most of them have become part and parcel of the hospital system or the healthcare system. And therefore, even when you come in, it becomes difficult to differentiate them. All right? It becomes difficult to differentiate between voluntary and regulatory standards. So we obey both of them, and we treat them the same, even though one is not biting more than one is not biting as the other. All right. Voluntary standards provide significant assistance to health personnel because they are developed according to best practices. Voluntary standards provide significant assistance to healthcare personnel. So if an organization or entity that whose standard is not legally binding on the health facility, but practicing that standard gives better patient care and protects the worker, which is sterile technicians like you and I, okay, future technicians like your type, if whatever standard voluntary will protect you and safeguard you and make sure that that family member of yours will walk into a health facility and come out healthier than before, then even though it is not legally binding or required, I think it is better or it is good we put that standard into our practice. That is all that this point is talking about. The voluntary standard provides significant assistance to healthcare personnel because they are developed according to best practices. Okay, nobody will go and tell or put a standard or any rule there, whether binding or not, that will let you do something that is not right. Okay, so best practices, even though it's not binding, it is good if we toe that line. Statutes and laws made by legislature, while regulations are laws set by our government. So statutes, Congress will pass statutes. And they are, once Congress passes the statute, it becomes the law of the day. Congress, why will Congress pass something and becomes the law of the day? Congress is representing the people. So Congress speaks for the people. So whatever Congress passes, that becomes the law. Okay? It becomes the law, and that law must be followed to the letter. Nobody can break that law. Even the congressman, when he breaks it, the law will bite. Okay, but for regulations are rules that are set by the government. So not all statutes or not all regulations are what? Statutes. Okay, not all regulations are statutes. Okay, the government can make a law or a regulation, but it is not approved or it has not gone through Congress, so it is not cannot be regarded as what a statute. Any questions so far? I don't want to be the one doing so much talking. Today, I'll engage a lot of you. We have a lot of slides that we'll take. So a lot of you will be engaged. Unfortunately, I don't know all of your names, but I will need a lot of volunteers to do that. Can somebody volunteer and read this slide for us, please?
Yes.
Okay.
Oh, okay.
Yes, go ahead, whoever is ready.
Okay. Consequence of non-compliance. Statutes and regulations must be followed, and failure to comply with them may result in legal consequence to the healthcare facilities.
Okay, good. Yes. Go ahead.
Regulations and voluntary standard may include workplace safety issues, which may help protect CS professionals from exposure to infectious agent and toxic substances.
Okay, you stop there before I let you take the last bullet. So the first point is explanatory. We did look at that. That statutes are laws passed by Congress. Regulations are rules that have been made by the government. Okay, all right. And these statutes and regulations, they are legally binding. And if you break them, yes, you pay a price for it. So as a healthcare facility, if you break any of the statutes or regulations passed by Congress or the government, you will get punished. Okay, so that is why you cannot, if somebody walks into a hospital, you don't have to force the person to pay before you take care of the person. You have to attend to the person, get the person well before you can bill the person. If you refuse somebody's care because he has no ability to pay, that hospital can be collapsed. All right. Then the second one, yes, voluntary standards may include workplace safety. It helps us, these voluntary standards help to protect, to provide safety by making sure that center staff technicians or professionals are not exposed to toxic agents or hazardous materials. We looked at some of these toxic materials yesterday, getting instrument contaminated, or things that come to CSPD or Central Staff Processing Department contaminated. These standards, which are written by bodies other than the government or the Congress, can provide some level of safety to workers so that if they follow these standards, they will help prevent exposure to these toxic substances. I'm telling you, when you come to the healthcare sector, there are a lot of substances that you'll be exposed to. You need to be extra cautious when dealing with them. That's why it is important that when you get in there, you have to follow the dress code that your department requires, or the recommendation of dress code that is what required for doing any activity that you have been assigned. Yes, the one who was reading, take the last point. Let's go.
Okay. Regulations and voluntary standard may include disinfection and sterilization practices. These standards and regulations may be helpful in pre-purchase product evaluation.
Okay, so voluntary standards may help to help us to disinfect it. This properly. It will help us to sterilize instrument or items properly if we follow them. All right, even though they are voluntary, if we follow them, we'll get the best results. The patients who come to us for safety and care will also go home not taking home anything that is dangerous or harmful to their body from the hospital. The hospital is supposed to be the most safest place to be, but I'm telling you that it is not the case. If you go in there, is a lot of different kinds of diseases and sicknesses that are hovering all over the place. So you need to be extra cautious over there. Yes. The next slide that we have, yes, can I get a volunteer to read it? These are definitions. These are definitions or definitions of what we just looked at. The statutes, the regulations, the standard, regulatory standard, voluntary standard, and then best practices. This is what we have. Statutes, we said Congress make them, and they become, Congress can be at national level, which is Washington. If you come to the state of New York, you go to Albany, you'll find Congress there. They have Congress, and we have state states, we have state congressmen. And even if you come to the city where Mayor Adams is the head, they have councilmen and women and what have you. They all make rules, okay? Some of the rules that the law they make passed by the city sometimes do not affect the state. Somebody who lives in Manhattan, it will affect the person. If you go and live somewhere in Syracuse, whatever they have passed in New York City will not have anything to do over there. So even though it's a statute, at various levels of government, those statutes could be passed. Then we talked about regulations. Those are rules made by the government. So when we talk about the government here, we are talking about what? The White House. Or Mayor Adams gets in. If you come to the local government level, Mayor Adams' office can make that. When you come to get to the state level, Governor Hochul and her team of officials can also do that. They will say standard is a uniform method of defining basic parameters for processes, products, services, and measurement. So it's a uniform, something that is supposed to be across board. That is a standard. The standard practice in Mount Sinai should be the same standard practice in maybe NYU. You go to Presbyterian Hospital, the standard should be the same. Or the standard in New York, you go to California, should be the same. Then regulatory standard that if you break them, get punished. Voluntary, they are not, you don't get punished if you break them, but we encourage they are followed. The best practices, a method or technique that has consistently shown results, superior to those achieved by other means. So a method or technique that has consistently best practices brings best results. So if you do it on a consistent basis, you should get results that is equally as good as other practices that are being done elsewhere that are acceptable. Now, let's go and look at some entities that either make voluntary standard, regulatory standards. Okay, so we're going to look at them. Some of them are government institutions, some of them are established by Congress. So we want to look at them. The first one we want to look at is FDA. And I can promise you that when you go to take your Central Sterile Processing Technicians exam, I am very, 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 very positive that you will get at least 2 questions from this particular heading you are seeing on your screen. FDA. Okay. Food and Drug Administration. Food and Drug Administration. Yes, let's see if we can get a helper to read that for us.
I'll take it.
So mark it down. I said at least 2 questions. FDA, at least 2 questions. You get it there. Yep, go ahead.
All right. U.S. Food and Drug Administration, FDA, role and responsibilities. Ensures the safety and effectiveness of food, cosmetics, drugs, biological products, medical devices, and electronic products.
Okay, stop there. So one will say that what has food got to do with Central Sterile Processing? I'm working on instrument. What has food and drug got to do with me? But the first point that our brother just read, you saw medical devices. That is where your department comes into play. Medical devices. So the instrument we are going to be dealing with are all medical devices. And FDA regulates this. They check this. They have a say in this. They have not a say, they have a big say in that. All right. So that is where FDA comes in. If you just look at the heading alone, you're like, come on, what has that got to do with me? But it has to do with you because they also regulate or they also have an oversight responsibility over medical devices that come into our department for reprocessing, transport, care, and all other related issues. Yes, go to the next one.
Operate under the
No. Director, no, the same slide. We are not done. Sorry about that. Good. Thank you.
Operate under the Public Health Service within the U.S. Department of Health and Human Services.
Okay, so it's under the auspices of the U.S. Department of Health and Human Services. Okay, the umbrella under which every hospital falls. That is where FDA is. Okay, that's what it means. Yes.
Regulation of medical devices requires pre-market clearance for new devices.
Okay, so if you are an inventor or you are a manufacturer and you make a new device that is supposed to be used in a medical setting, in a hospital, in any facility, on human beings, on people, it has to get cleared. You have to present your papers, if I may put it that way, simply put, your papers before them, tell them how this device is supposed to work, the safety measures that are there, what are the likelihood, what are the do's and the don'ts of it. Okay, so they will study it, see all the paperwork you have put in front of them, all the literature that you have put in front of them to review. They will look at it, okay? If they clear it that it can go into the public system, that is when you can go in and, try it somewhere and then eventually market the product. So that is why it means by saying they require pre-market clearance for new devices. There's no new device that will go into the healthcare system without getting FDA's attention. If you do that, for those of us who work in the healthcare center, the director, myself, and then all the teachers or the professors on this platform, when a new device comes, we always ask whether it has been cleared by FDA. Okay? Because nobody wants to get in trouble. Because if you mess up with FDA, my friend, you will not have it easy. So no hospital plays with FDA. Yes, next slide, director. Any questions so far?
Yeah, I have a question.
Okay, great.
You made mention of the FDA having a big say in the medical devices. How do they have a big say in the medical devices?
Okay, all right. Yes, let me give opportunity to anybody on the platform who has any idea to share regarding the question our brother asked. How does the FDA has big say in medical devices?
Professor John, let me make an input here. So,
okay.
Yeah, FDA has a lot of input in how medical equipment should be manufactured, how it should be used, and how the type of materials that manufacturers are supposed to use in manufacturing their equipment or medical instrument. In subsequent slide, you will see the classification. Exhibit A on the screen. You can see the classification as propounded by FDA, how instrument should be treated. If it is class A, is it a low risk? If it is class B, what kind of risk level is it? And if it is class 3. So in subsequent slide is going to be self-explanatory. It will make sense to you. Okay, Joseph.
Thank you.
Okay, so to add to what the before I give if somebody has something to add to what the director said, yes. So they have a big say because you are going to use it on human beings, and it is human beings who have to use the device. Is it going to cause any injuries to people? Okay. Is it going to have a long-term effect on the people that at the end, after they have been used on the human being? Is it going to have an effect maybe 6 months down the line? 3 years down the line, somebody is going to be coming back with some complications of some sort. So FDA has a big say. You have to provide data that those things will not happen. You have to convince them that it will not happen. Otherwise, they will not allow you to go in to the market and sell that product. Does that make sense?
Yes.
All right. Great. All right. Does anybody have anything to add before we proceed?
Yeah, I wanted to add what you just mentioned at the last part, that the pre-market, or else you won't go to the market. And if you don't go to the market, imagine you created all this to leave it at home. You need to take it to the market, and they are the only people that will clarify you to go to the market and sell it, because it's going to do what you say it's going to do, and they've tested it and made sure it's going to be good on humans. Are we clear?
Okay. Thank you, Professor Japon. Thank you. Yes. Yeah. Thank you so much. It's good to have all the professors around so that we can all drive home what we are trying to give to our brothers and sisters on this platform. So, medical device classification. So, the FDA, because they have oversight over the medical devices that we handle as professionals, they have 3 levels of classification that they have put all the medical devices that come into the healthcare system. Okay, so with this slide, let me take it myself. So let's go. What class 1 device? Class 1 device is, it is classified by FDA standard as low risk. Low risk. This includes basic surgical instruments, the cookers, the scissors, the towel, sponge sticks, the Addison faucet, all the simple basic instruments that you'll be seeing very, very soon, once you are done with this course, are classified by FDA as low risk. Ultrasonic cleaners, subject to general controls like registration, labeling, and quality regulation. Most are examples from what? 510K pre-market notification. All right. So the basic instruments that we deal with in the hospital setting, like the few that I mentioned, those are called class 1 medical device. They have low risk. It's not going to harm the patient. It's not going to do anything to the user. It's not going to do anything to the patient who is on the table. Only they have to have been registered. Okay, they have to be registered. They have to be have a labeling. Okay, they have to have obey quality regulations, mean that they have been tested to show that the material that were used in making them will not in the process decompose in the patient or break and then break into pieces while surgery is going on or procedure is going on, and then all this will be deposited into the internal organs of the patient. All right. So they have to make sure that these minimum requirements are met, so that even though it is a low risk, you still have to meet a certain level of requirement for it to be accepted. And most of the time, they make sure that it falls in 510K pre-market notification. You remember we said for a medical device to go in there, you have to present it to get pre-market clearance. You remember that point? So that comes from that 510K pre-market notification. So you have to present all of those low risk medical devices to the FDA to get that clearance to proceed. All right. Then we have class 2 device, moderate risk. This includes sterilization equipment, biological, chemical indicators, and also this also requires 510K pre-market notification, performance standards, and pre-market surveillance. So moderate risk. Moderate risk. Moderate risk means that the risk is a little bit higher than the low risk. Is higher than the low risk. So a class 1 device, 2 device has a higher risk than a class 1. Okay. And some of them are what they have mentioned: chemical indicators, biologicals, sterilization equipment. We are now speaking because you are not in the field yet. Some of these things look like appear in a vacuum in your mind eye as something that so special. You have not even seen it, so it makes it too complicated. But these are simple stuff, simple machines that when you come in, simple devices, when you come or you begin to work in the department, you see them, you remember and say, oh, this is what they were talking about. So simple. It's not anything so complicated. All right. So once again, even though it is a medium risk type of medical device, it has to again meet a basic level requirement for it to go into the market for sale. Then we have the class 3, higher risk. This is the highest of higher risk that you can get. Include heart valves and pacemakers. Heart valves and pacemakers. So heart valve and pacemaker, where do you think those devices can be found if they are used? Where do you think they can be found? Professor Japon and the director are not part of this question. The rest of us are part. Where do you think heart valves and pacemakers are if they are used? Where will they end up being if they are used?
The OR.
In the OR. No, wait, okay, in the OR they'll be, but what goes on in the OR?
Surgery.
Surgery of the heart.
Surgery. So if in the OR they are found in the OR and they are used in the OR, where will they end up after use?
In the heart.
Plant in the chest.
Again.
They plant in the chest.
The last person who said something in the chest. Yeah, can you repeat that?
They plant in the chest.
Yes. So the valves remain in the human being. Okay. That is why it is classified as a higher risk. Something that is not made by God, but it ended up in God's environment. Okay. It means that this device is going to alter the way God created you. So that is why it is classified as a higher risk. It means that your heart will not function without that valve. And if your heart will not, or that pacemaker, if your heart will not function properly, and this will help you to function properly, it has to get the highest of highest clearance by the FDA, because they are putting somebody's life at risk. So pacemakers and heart valves are classified as high risk medical devices. Okay. Today you have other ones that are also I think they have some devices that they can plant in you that will enable you to be able to sleep. I don't know what they call them. So all of those are high risk or class 3 medical devices. Sorry. So if any device is done that will stay in the internal body of the human being, that device is classified as what? Class 3, a high risk. And this area is a possible CSP or Central Sterile Processing Tech exam question that I told you earlier on you should be looking out for. You can get a question around that, this classification of devices. Any question before we take the next slide? All right, somebody help me out with the next slide.
So I have a question.
Okay.
Director, can you go back to the previous slide, please?
Yeah. The classification.
Okay, thank you. So when you look at the class 1 and class 2, we have 510K pre-market notification. When it comes to class 3, it has pre-market approval. What's the difference between 510K pre-market notification and pre-market approval?
Okay. All right. Yes. So yes, the question is, what is pre-market approval and then pre-market notification?
The difference.
The difference, yes. So that is his question. I want to give the opportunity to somebody, director and Japan, Professor Japan are not part of it. Let's see if amongst ourselves somebody can save the situation before we come in.
All right.
Can I?
Yes, go ahead.
Okay.
Was somebody
You can
we can't hear you.
Contribute.
So you want me to take it or you want taking it?
Okay. So pre means before. If we know that pre means before, that means when it says pre-market, before it goes to market, they have to check if everything is okay. So to the pre-notification or pre-note, that means before they will notify you that everything is okay, so you can send it to the market. That's my understanding.
Okay, that is his idea. All right, let's take one more for the sake of time. One more, then we provide you the response.
Okay, my understanding is the class 1 devices, because they are low risk, so they don't cause any major injury or something. So they don't need pre-market. They don't need to be pre-market. Like they don't need to get approval before. Whereas with the second class devices, because they kind of like moderate risk, they are classified as moderate risk. Therefore, they need to go under approval, pre-market approval.
Okay, so you realize that 1 and 2 are all say that pre-market notification. That was his question. But the third class 3 is pre-market approval. So the difference is that notification, you are just creating the awareness of the FDA that you have something a device that you have manufactured that you want to go and sell. Okay, you can go in and sell it whilst they are looking into your invention or your product. Okay, so it's just a notification, just as it is stated. But for something that will live in the patient or the human being, it cannot go in unless they approve that pre-market notification that you are putting before them. Does that make sense? Now, our brother will ask the question.
It does. And also, the 510K doesn't mean anything or just thin.
Oh, it does, but it just escaped me what it did. There's a meaning to that 510, but it's just that it escaped me what it is. I don't know. Maybe the director or Professor Japan has any. One of them remembers what that 510K. The number there. I don't know whether it's a regulation. Maybe they have a certain numbering that they did, or it has some meaning. So let's hold on to that. Okay. In our subsequent class, I'll try to get you the answer to that. Okay. Hello.
All right, thank you.
John, we will see it soon. We will see it soon.
We'll see it soon. Right. Okay. So maybe along the line we'll see it somewhere. Okay. Yeah. It cannot be 510K without a meaning. It definitely does. All right. So let's take it. Go take us to the next slide, Prof. Director. Yeah. So 510K submission needed for most class 1 and 2 devices to show they are substantially Oh, my screen. Where is my screen? Sorry, guys. Oh, I'm so sorry. I had some technical hiccup. So it says needed for most class 1 and 2. The submission is needed for 1 and 2 to show they are substantially equivalent to existing products. So it means that whatever you are bringing has something that is already in the system. Okay, so you are just submitting, creating awareness that there's something that you've also done that has something that is similar in the system. It's not so critical. It's not, the risk is very low. It's not going to cause any death of any kind. Okay, so that is the 510K submission. The MPA submission required for most class 3. So PMA submission, pre-market what? Approval. That's what the PMA stands for. Required for most class 3 devices to demonstrate safety and efficacy before approval. So whatever, if you have a device, you have manufactured something, which we are praying that all of you on this line, one day you manufacture something, and then that will help save humanity. But yeah, if you are able to do that and it's going to stay in the patient, you have to demonstrate that it is safe to live in the human being, and it is efficient, or it is potent, or it is going to do the job for which you say it is going to do. Okay, you cannot manufacture a device that you say will help people to sleep, and then they put in the human being, and then the person is awake 24/7. All right. So it has not gone in to do the work it's supposed to do. So one, it must be safe, and there must be data to show that it is doing the work that you have designed it to do. So pre-market approval, MPA, must or is always associated with what? Class 3 medical devices. So that can be a question by itself. Which class of medical devices must receive pre-market approval before they are used? It's a question. It can be a question. I'm not saying that's the question that is coming, but it's just a question that you can ponder about. So I provided you the question. I provided you the answer. The next one says pre-market what? Surveillance. So it's FDA may require data collection on product performance in real world use to confirm assumptions made during design and manufacturing. So if, again, if you say a device is going to help people to sleep and it is planted in people, they have to go to the people who they have implanted those devices and then ask them, collect information, collect data. How many of these people came back complaining the device is not helping them to sleep? All right. So whatever information you have presented in front of the FDA for approval, when the approval is granted based on the information you are giving them, that is not the end of the story. They go back and collect data from surgeons, from direct patients, from patient families, okay, from vendors who are selling the product. So collect information to see that what you are saying it is doing, it is actually doing that. So approval of the FDA, it doesn't end there. They go beyond and collect information to authenticate or confirm what you say it will do, it is actually doing that. Okay. Any question before we go to the next slide? And when we get to the next slide, I'll ask for help.
John, let me add this. Joe,
Yes.
so the number 510K, if you're still wondering, is the section of the FDA act or regulation that requires the manufacturer to notify FDA of their intent to market device in the market. So if you're wondering if that number means anything, when you are talking about regulation, there's sections and acts. So that number is the reference in the FDA regulation.
Okay.
Perfect. Thank you.
So it means that if let me add something to it. Director just helped me to. So if you look at the 510, and then you see that the K is in bracket, right? So that K, so it means that at 510 there are a lot of 510s, and each letter will have a specific. It's talking about a specific regulation. So for pre-market clearance or pre-market notification, it goes with the letter K. All right.
All right. Thank you.
Okay. Good. Okay. The next slide. Director, thank you so much for saving the situation.
Sure.
All right. Yes. Can I get a volunteer? We should have about 20-something volunteers on the line on the platform. Yes, 27 volunteers. So 24, excluding myself, Professor Ejapo, and the director. So we have 24
Professor John, I think you should start, pointing so that people who are sleeping
I don't know.
call them out.
I don't know their names. That is why
just call them on the screen. Or if you want, I can pick them for you. Jawara, go ahead.
Okay, all right. So yes, that you help me. Be the
Jawara, go. If you're sleeping, wake up. Let's wake up.
Don't do that. Okay,
Jawara, let's go.
Jawara, let's go.
Okay.
Next time it's gonna be Gifty, then Asantua, then Yusuf, then Umi.
Right.
All of you, Tawfiq, Mujib. Okay, Mujib, maybe not for now.
Okay.
Hadi, Okay, but
so
Jawara,
you know what we are going to do? When Jawara is done, Jawara is going to choose the next person.
Oh my God.
That's a good idea.
Yeah.
Just mention randomly.
Director, I've been contributing all the time.
Yeah, that's true. Actually,
yeah.
that's why.
So Jawara, let's go. When you are done with this slide, you choose somebody, your favorite, on the platform to do the next slide.
Okay. Medical device reporting requirements. The Safe Medical Device Act of 1990. Act of 1990 mandates healthcare facilities to report medical device malfunctions to the FDA. Previously, only manufacturers were required to report death, serious injuries, or device malfunctions that could cause harm if repeated.
Okay, hold on there. So the Medical Act of 1990 Act, it means that Congress passed it, all right? That Safety of a Medical Device Act of 1990, the Congress passed it. That at that time, it was the mandate of the manufacturer, the one who designed the piece. It was the one who is supposed to report. How can somebody who manufactured something who is not using it know that it caused death? So they were not getting the data that they were getting. Now, it will be difficult for somebody who manufactured a piece who is not using it at the hospital. Maybe manufactured the piece, the device was manufactured in Canada, is used in another hospital in California. How would they know that the device caused death if it is supposed to be reported by the manufacturer? So Congress sat down and realized that no, the burden cannot be on the manufacturer. Okay, it must be on the end user, the one who is using the device. If it causes death, they are the people who witness it. They can give an accurate account of what happened. So this act evolved by the FDA, and then it became a rule that if any medical device causes injury, death to anybody in a healthcare setting, we are not going to wait for the manufacturer to report. it is the responsibility of the people who witness it to report the injury, the death, or any harm that it caused to anybody. All right, Jawara, let's go to the other side.
Mandatory reporting requirements. User facilities, hospitals, surgical centers, nursing homes, outpatient facilities must report device-related death to the FDA and manufacturer within 10 days.
Okay, so if any device causes, if let's say God forbid, this is just a hypothetical example. If you have a device in your department and then you are cleaning it and you are following the standards, the rules, the guidelines that are stated in the IFU of the manufacturer to cleaning the piece, and your finger is chopped off, okay, you are supposed to report that within 10 days to FDA, so that if there is supposed to be a recall, they will recall that device. And if there is any compensation that is supposed to be paid by the manufacturer for that error, the compensation is what paid. If you wait beyond 10 days, then the facility could also be fined for what? Negligent. All right. So you will get to know that as we move along the line, that there will be these recalls when something happens, a device malfunctions, it causes death here and there, injuries, the rate of injuries are so high, the FDA will recall that device, and then the manufacturer will be asked to fix whatever that is causing the problem, or if it cannot be fixed, they completely withdraw the whole device. Okay, that's why when you sometimes you read in the news or you watch the television, you hear, they are taking some food items off the shelves in this market because they have a certain metal in them. Who is doing that? It's the FDA that is doing that, because people are reporting incidents of what? Sickness or infections or poison and here and there. So the same thing, if any device malfunctions and causes death or injury, they are supposed to be reported to FDA by the hospital, surgery center, or wherever they are being used within 10 days. If you don't do that, you break the law and you could be what? Punished. Yes?
Report serious injuries to the manufacturer within 10 days or to the FDA if the manufacturer is unknown.
Okay. If the last part, let me take the last part before. If the manufacturer is unknown, then it means that somebody smuggled the device into the hospital system. Because there's so much bureaucracy in the hospital system that you have a device that will not have a registered name or a trademark that will identify who the manufacturer is. But let's just assume, without admitting that it happened, that a device found itself into the hospital system. You don't know the device, you don't know the manufacturer, you know the device, sorry, you don't know the manufacturer, and it causes injury. I think that this is even easier to take it out of the system, because it probably means that the FDA has no any pre-market notification of any sort. But regardless of whether it has or not, whether it is known or unknown, if there are any serious injury, the manufacturer also have to be made aware. Or if the system, the device is not functioning properly, the manufacturer also has to be made aware, so that if there's something they have to adjust to get it to work the way they intended to, they will do that even before it gets to the FDA for the product to be recalled. So it's our duty to also report, and that reporting also has to be done within 10 days. So reporting to FDA within 10 days, reporting to the manufacturer within 10 days. Yes, last point.
Submit semi-annual reports of death and serious injuries to the FDA.
Submit annual.
Semi-annual.
Semi-annual. Semi-annual means that half of the year. Half of the year, you must submit a report. of death. So let's say a device was pre-approved or cleared or approved. If there is any death within the first 6 months, it has to be reported. If there is no death, it also has to be reported that the device has not registered any deaths. So there's always collection of data. That is the surveillance part of the FDA's job. They are always collecting data. And then it is stated in parentheses or in bracket here, either 1st January or 1st July. So January 1st, you...
Who reports to the FDA?
Who reports to the FDA?
Yeah, is it the SPDs or?
Okay. Very interesting. I want to see how people. So again, Professor Japon and Daida are not part of it. Let's see who reports to the FDA. The rest of the 24 of us. Who reports to the FDA?
The Service Providers Administration.
The Service Providers Administration.
Yeah.
Mm-hmm.
The Secretary of Health and Human Services.
The Secretary of Health and Human Services. The Secretary of Health and Human Services is somewhere in Washington. How will he be in my Mount Sinai Hospital and report? It has to be internal something. But the question our sister asked, Jawara, you are the one who asked, right? Hello?
Yes.
Okay. So this is the question Jawara asked is it SPD's responsibility to report to FDA, or how is the reporting done?
I believe there should be a channel for such reports, maybe from the one using it.
Yes. So every hospital will have laid down procedure of how this reporting is done. But being that it is, so if it is the device malfunction in the OR, the doctor, the nurses, or the team that was in the room will make a report. That report is taken to higher ups, and then eventually somebody communicates that report to the FDA. If it happens that the injury is always happening at CSPD level, then the manager reports to the director reports to his superior, the superior takes to the next level. So there's some form of bureaucracy and takes all the way till it gets to the person who is supposed to report to the FDA. Does that make sense, Jawara?
Yes, thank you.
All right, great. Next slide, please. Jawara, make a choice. Okay, let me take this one. This one is short, so let me take this one. When I get a big one, then I'll let Jawara. So Jawara, be looking at the class attendance over there and see who you want to your lot to fall upon. So mandatory reporting requirement continues. Okay, so it says serious injury is one that is life-threatening, causes permanent impairment, or requires medical intervention to prevent permanent damage. So if we say an injury is serious, it means that somebody's life is on the line, or is going to bring about an impairment that will permanently live with the person for the rest of his or her life. That anything that will lead to an impairment, permanent impairment, threatening the life of somebody's existence, then that injury is classified as serious. Okay, that injury is classified as what? Serious. If there is any chemical that we are using in decontamination, any detergent that maybe when it splashes the floor and you inhale, you pass out right away, then it means that it goes into your eye and you become blind, or you need some form of surgery, eye surgery, to be able to see again. It becomes something serious. Then that needs to be reported quickly. The CSPD or CS department may need to report sterilization failures if linked to patient what? Patient illness. CS department need to report sterilization what? Failures if linked to patient what? Illness. So if the biologicals that we are using, which is classified as class 1, biological is classified as class 1. Class 1? 2, yes. So biologicals, which is classified as class 2, which is that falls under our department. If for any reason it fails, you sterilize, you expose it to temperature, humidity, and time, and the biological fails, turns positive, then we need to report to the manufacturer. The whole pack is turning negative, positive. You are running. I remember there was a time we had a pack of indicators, which is also a class 2 medical device. These indicators were not passing. It means that the chemical was not traveling to the safe zone for us to declare the instrument as being sterilized. Okay, so we needed to report this to the manufacturer that there was something that was not right. So as CSPD, we also need to report sterilization failures if we do receive them, so that those items will not be used on patients that at the end of the day, they'll come back with more complications. All right. Jawara, before you choose, we go to the next slide. Read the green highlighted box there for me.
Okay. MedWatch, a safety information and adverse event reporting system that serves healthcare professionals and public by reporting serious problems suspected to be associated with the drugs and medical devices they prescribe.
Okay. Okay. So it means that under MedWatch, everybody has the opportunity to go and make a report there. So if your family member is negatively affected by a medical device, you can go there and make an incident report. Okay, beautiful. Now I got a big slide. This is where I need Jawara's help. Jawara, let's go. Get somebody.
Topic C. Is it topic Q?
Tawfiq, are you there?
Yeah, I'm right here.
Okay, my good friend Tawfiq, you are my best friend. So now Jawara has chosen you. The Lord has fallen on you. So let's go, my brother.
Medical device records and FDA requirements. Medical device records. A record is an action taken to address a defective medical device that may pose a health risk. Record can be voluntary by manufacturers or distributors or mandated by the FDA. Not all records require device removal. Some only require inspection and some require inspection or repair. The FDA monitors all mandated records.
Okay, stop there. So a recall is an action taken to address a defective medical device that may pose a health risk. So to recall somebody means to ask to come back. Okay, so device, if we ask that a device be taken out of service, then that is a recall. And Professor Japon and director and myself, we get this all the time. We get this all the time. All the time. Sometimes you use a device for maybe 2-3 years and then there's a notice. You get a notice or an email, that this thing, it needs to be taken out. We get it all the time. All right. Okay. When there is a recall, is either mandated or voluntary. Voluntary by manufacturer or distributor. It becomes voluntary if the manufacturer is asking you. It's just a quick fix. With the manufacturer, it's a quick fix. Okay. Sometimes even the cars that we drive, the manufacturer will say, oh, maybe you have detected something, bring it back for them to fix it, and it isn't. In the letter they'll tell you it's voluntary. But with the FDA, if the FDA issued a recall, it has to leave the facility as soon as possible. All right, it becomes a serious issue. So FDA recalls require device removal immediately. It means that it's causing serious harm than good. So all FDA monitors all mandated recalls. If they ask you to take it out, you don't take it out, and then within the stipulated time it is used and somebody complains, the hospital can be shut down.
Professor John.
Okay. Yes.
If you hit any point, we can go out for the 15 minutes break.
Yeah. So let's finish this slide and then we can go for the 15 minutes break. Okay. Taufik, yes, take the left side and let's go.
Types of FDA recalls. Class 1, high risk, likely to cause serious injury or death. Requires public notification and manufacturer or customer alert. Class 2, moderate risk, may cause temporary or reversible health effects. Customers are notified, but press releases are usually not issued. Class 3, low risk, unlikely to cause harm or violate FDA regulations. Require manufacturer notification, but not public alerts.
Okay. Can you relate to FDA classification of medical devices and FDA classification of medical recalls?
Yeah, what I can see here is like it's upside down. It's upside down.
Thank you. What's your name? What's your name?
Amda.
Amda, yes, you got it right. You see that it's a flip. Okay. Class 3 medical device is
from low risk to high risk.
It's a high risk. And then class 3 medical device is a high risk, and then class 1 is a low risk. But in terms of recall, class 1 is more serious than class 3. Okay, so class 1 high risk, class 2 moderate. So class 2 is kind of where it is, right? It's the class 1 and class 3 that has flipped. So class 3 is a low risk in terms of risk level, but in terms of the devices, class 3 needs pre-market approval before it can work. So like our brother Taufik read, high risk ones, which is class 1 devices, means that these ones will result in death, require public permanent impairment of some sort, or permanent injury that the public need to be made aware immediately, and that device needs to come out of the shelves as soon as possible. Okay, class 2 may not cause may cause temporary or something that can be fixed, an injury that can be fixed. And then for class 3 low risk, unlikely to cause any but people need to be made aware that if you see some symptoms like this is what it is happening. It's nothing that you should be alarmed about. I think it is more appropriate to pause here. We are going to assume that it is 4:20. That we are going for 15, right?
Correct. Yes.
Yes. So we'll come back. So 4:20, we'll come back 4:35, right?
Yeah.
Okay, good. Thank you.
Thank you, everybody.
Yeah, so FDA labeling requirement for reusable devices. The manufacturer must provide detailed instruction for use for safe reprocessing. So it is the responsibility of the manufacturer who is making the device to provide detailed information as to how the device is going to be used and how it is going to be reprocessed, how it is used, how it is reprocessed. So you're not supposed to submerge it in water, you don't do that, okay? So that you can keep the device, you can prolong the life of the device. And hospitals, they must ensure they have the proper equipment and resources to follow the manufacturer's instructions. Okay, you must provide that. And then another requirement that is needed by the FDA on the part of the manufacturer is that they should validate and document that their reprocessing instructions are effective. They must have a document to show that the information or instruction they are giving for reprocessing the instrument or the device is effective. Okay, is very, very effective. It should not the processes they have outlined should not lead to the malfunction of the instrument or the device. It shouldn't lead to decolorization of the instrument or shouldn't cause any injury of any sort. All right. And then on the part of the healthcare care, they must also verify and comply with IFU to maintain patient safety. So what the manufacturer says we should do, that is what we should do. If the manufacturer of your iPhone says that you should not drop it inside water and you feel that no, you have got screen protector so you can dip it inside the water, be prepared to go to the market again and get a new one. Okay, so we have to follow the IFU of the manufacturer to make sure that we are processing the instrument according to given or outline instructions so that we can keep our patients safe. Next slide, please. Reprocessing of single-use devices. Single-use devices. Single-use devices are kind of disposable. You use it, you trash it. So if any manufacturer wants us to use, or any hospital decides to use to reprocess single-use items, you will have to follow certain guidelines and you will have to meet some requirements. That's what we are looking at here. Say required hospitals and third-party reprocessing to comply with 510K regulation for single-use device reprocessing by August 2022. All right, so that is what the document is talking about. What are they supposed to do? Hospitals must prove they can properly clean, sterilize single-use items to meet original manufacturer's standard. If a hospital decides to reprocess something that is supposed to use only one time, okay, like disposable plates, you use it, you throw it away, but you decide that you will use it again. If the disposable plate is paper, it means that you have to wash the paper. If you wash the paper, you have to dry it. Will it be the same? Will it be able to serve the purpose as original? That is what this point is talking about. So if you a hospital or healthcare facility decides to reprocess single-use item, they have to make sure that they meet it, they properly clean it, it's properly sterilized, and the functionality of the device is the same as its original, as from the original manufacturer. And then facilities may outsource single-use device reprocessing, but they are legally responsible for that action. So they can also contract a third party to do that. But the fact that you have contracted a third party to reprocess something that is supposed to be used once doesn't absolve you from responsibility. If any patient comes back complaining that because you have used a single-use item that was reprocessed, because of that, he or she has got an infection or permanent impairment of any kind, the act is going to fall on the hospital or the facility. Even though you have a contractor, the contractor is going to say, hey, you knew what you were doing and you gave me the job. All right? You vetted my proposal. You think I can do that. If it didn't work, hey, it's on you. All right? Next slide, please. Center for Disease Control and Prevention. When you see CDC, what comes to your mind?
Infection control.
COVID.
COVID, yes, that's the one I'm looking for. COVID, because you could not have been in America for the past 5 years or 4 years and you would never heard CDC. And when you hear of COVID, what comes to mind? What follows? It starts with a V.
A virus.
Virus, or what cures the virus?
A vaccine.
Vaccine. Yeah, so virus, vaccine. CDC, virus, vaccine. Yeah, you see the whole thing. So the CDC, a couple of years back, was so popular because of COVID-19. Okay, it is not because of COVID-19 we are talking about CDC. Let's see beyond COVID-19, what is CDC responsibility? So CDC, Center for Disease Control and Prevention, is a federal agency organized within the U.S. Department of Health and Human Services. Dr. Fauci was operating under that, okay? It works to promote health by preventing and controlling diseases, injury, and what? Disability. So the primary disease is to control the prevention, to make sure that a disease does not even break out. And if it breaks out, what mitigating factors or decisions or actions will be taken to control its spread. We knew or we heard there was a COVID-19 in China. We sat down, and then it crossed border and came. And then everybody was masking up, wearing gloves and here and there. And eventually, it's not part of our life. All right. So that is the job of the CDC. They have to promote health by preventing and controlling diseases, injury, and disability. CDC developed first practical recommendation for isolation techniques and then infection control. So wearing of mask, facial shield, gloves, do not touch. You remember 6 feet? When COVID-19 came, 6 feet was the recommendation of CDC, right? Make sure that you are 6 feet away from this because they felt beyond 6 feet, the virus will not be able to travel. Or if you sneeze, be 6 feet away from somebody, the person will not get infected. I don't know whether it worked, it didn't work. I don't know. I didn't go to medical school, so I can't really tell. But that is the job of the CDC. They make practical recommendations for isolation and techniques to control infections. All right. So when COVID-19 came, almost every week there was something new that we were supposed to do, and all of these recommendations were coming from the CDC. So CDC is to make sure that they can control disease. They have to make sure that they have to prevent it from even happening. And if it did happen, they have to make sure that they contain it, control it, limit it to a particular geographical location so that it doesn't spread, okay? And so that they can quickly get a remedy to the situation. Guidelines are widely used. The guidelines are widely used in, hold on a second, I can't see my screen properly. In healthcare facilities policies are incorporated into healthcare facility policies, but are regulatory, okay? But are not regulatory, yes. So their recommendations are part of policies that hospitals write down. Okay, but if you don't do what the hospital has tapped from CDC, you are not, I mean, there's no law that will punish you for that. For example, CDC said you should wear mask, wear gloves. People didn't wear mask. They didn't arrest them. Okay. People didn't wear gloves. They didn't arrest them because it's not a regulatory, that is what? Mandatory. Okay. It's not mandatory. And we said CDC's 2008 guideline for disinfection and sterilization. Evidence-based recommendation for cleaning, disinfection, and sterilization of medical devices. So in 2008, CDC gave some guidelines as to how to disinfect and sterilize some medical devices. Okay, so hospitals will incorporate this advice, these guidelines. They are not mandatory, but they help to what? To provide better healthcare to the family members and visitors, and then sick people who come there. Used by healthcare facilities and CS department to develop standards and procedures. Yes. So CSPD, we also use CDC policies. Example is if you are scheduled to work in Deconten, a lot of it you have to do with CDC. Okay, your outfit there. Okay, and you have to take off your gowns or your PPE. You have to wash your hand. You have to make sure that the scrubs you use, you don't put it on the next day because it's all contaminated and what have you. Okay, you have to make sure that you don't allow people who are not well, who are not in the right attire to come and stay with you in the content for long hours. Okay, because they are not properly dressed. So when we follow all these guidelines by CDC and what have you, we are also helping or making sure that our facilities are safe for ourselves and visitors who come around. Next slide, please. Department of Transportation. Department for Transportation. DOTS. So what has Department of Transportation got to do with CSPD or hospital facilities? Yesterday, we looked at off-site transportation of contaminated instruments. You remember that?
Yeah.
Yeah. So we said that contaminated instruments could be transported from one hospital or surgery location to another unit or building for reprocessing. We said the driver must be trained, the contaminated instrument must be secured in the cart, and then the cart inside the van also must be secure, so that shaking, bumping will not damage the instrument. There will not be spillage, and then people will get exposed to hazardous material. Let's see what Department of Transportation is helping do to keep workers and patients safe in terms of transportation within the hospital and between hospitals. All right. So it says the U.S. Department of Transportation is responsible for ensuring safe and efficient transportation system, including regulation affecting healthcare-related transport. So yes, they make rules for healthcare transport. That is not every van that are used in transporting vegetables cannot be used in transporting contaminated instruments. All right. So if you see a medical van, you will know. Okay. An Uber cannot be used to transport a sick and frail patient. It has to be an ambulance. Okay. Right. So Department of Transportation Regulation for Healthcare Facilities covers the transportation of soil medical device instrument for repair and reprocessing. So Department of Transportation outlines how instruments, dirty or those that are clean and are supposed to be sent to a facility for refurbishment are handled. You cannot just you cannot just use any van to do that. It has to be a van approved and designed, and it must meet the Department of Transportation system. And we agreed yesterday that where there is a conflict of federal and state regulation, the state regulation supersedes that of the federal. It's always strong. You cannot, the states are kind of independent on their own. Yes. All right. So Department of Transportation also requires healthcare to to regulate the transportation of hazardous and radioactive waste. Radioactive waste. We have I don't know how many of us have done physics on this line, but we have waves that are coming out of medical devices or some hazardous materials that are very harmful. Some hospitals have a check. I went to a particular hospital, and if you were transporting disposable items to its holding area to be transported, there's a device they mounted in the wall that if the materials were transporting to a holding area had any radioactive wave, an alarm will go off, prompting you to know that there is something in the waste that you are taking away that has radioactive waves, okay, or that has a radioactive material in there, or so that needs to be handled by a different expert or professional, such that it will not harm people along the way. So hospitals will have to regulate that. Okay, they must have measures in place to regulate that so that people are not put in harm's way. Okay, require proper biohazard labeling and containment when transporting contaminated instruments. This point was seen yesterday. It has to be labeled. When you label it, you are communicating an information. All right. Once somebody read biohazard, infectious, people will stay away from it. They will not touch it with their bare hands. They will deal, if they go in there, they will wear protective clothing to do that. Conduct inspections and issue citation for violations. Yes. So if you break the law, you are given a ticket. And tickets, nobody fancy tickets. Nobody enjoys seeing tickets. If you park your car in your car and see some red envelope on your windscreen, I don't think you'll be happy. All right. So hospitals don't want to see citations. Okay. State and local regulations may be more restrictive, I've said that, than federal ones. The federal ones don't bite more like the state ones. So where there's a conflict, or the state or the local laws are more stronger than this. So that is the role Department of Education carries. Department of Transportation plays in hospital setting regarding transport. We saw that yesterday. Next slide, please. So this is an example of a van. The picture is not so explicit, but you can, in there is a cart. The cart is, I believe, it has contaminated instruments, which we call soiled instruments. The cart is secured because I see something like some belting system holding the cart in place. Sometimes they secure the wheels on the side to the walls of the van, so that if there are the road is a bumpy one, the cart will not move to and fro, causing instruments that are in the cart to also move to and fro. This requirement or this regulation, this guideline is made possible because of Department of Transportation. So that is just a picture to show you what the job of Department of Transportation is. Next slide. EPA, U.S. Environmental Protection Agency. These are some of these, unfortunately, let me chip in some small politics here. These are all agencies that our Papa is trying to kill, to take them off. We got to close some of these agencies. Environmental Protection Agency, EPA, is one of his agencies he wants to axe out, want to take out. Yeah. So the EPA, it was created in 1970 by Congress. Congress created it. So it means that for the president to be able to ask the EPA, he will have to go back to Congress, give justifiable reasons why EPA must not exist. So our president trying to chop off some of the agencies is not going to have it easy. So for example of this one, since it was passed by Congress in 1970, it needs to go back to Congress for it to be removed. So yes, it's not good. It regulates human health and environment. The human being lives in an environment. The environment must be safe for the human being to live. So EPA makes regulations that governs both the coexistence of humans and environment. Okay, humans and environment must the rules or guidelines must be such that we both can coexist. The environment will be there for us, and then we will not make the environment extinct. Okay, the environment will not collapse. If the environment collapses, then we cease to be human beings. For example, if we chop off all the trees on the planet Earth, then the carbon monoxide that we give out will not be used, and then we will not get carbon dioxide that we give out. Then we will not get air to breathe from the plants. Okay, so we need the environment. The environment also need us. So that's why we have that coexistence. Key responsibilities of EPA: minimize greenhouse gases and toxic emissions. Have you heard of clean energy before? When President Biden was there, he was always talking about clean energy. Have you heard of that before? Oh, I think I'm the only person in the class.
No.
Oh, okay.
No.
All right. Okay. Thank God. Jawara, are you there?
We are here.
Yes,
Okay.
I'm here.
Okay, good. Yes, awesome. So minimize greenhouse gases and toxic emissions. Okay, it is the responsibility of EPA to make sure that cars that or any manufacturing center that produces a lot of toxic emissions, they cut down those, because the air gets polluted. We take in all of these toxic gases, and then we get sick. We get issues related to our breathing. Our hearts become weak. They cannot function the way it's supposed to, and then we contract all manner of unexplained conditions. And so the EPA tries to check that. Okay, regulate reuse of solid waste. Reuse of solid waste. So if waste is supposed to be reused, okay, somebody will say, how do we reuse? Yes, you'll be surprised that something that is waste somewhere is a resource in another setting. Yes, so they reprocess that, I don't want to spoil somebody's. If I don't want to, let me not give that example. Okay, a lot of things happen. Something that is wasteful in another area is very useful in another design. But you have to make sure that once you are using it somewhere, it must not produce negative impact. So that is to the environment and then to the human being, and that is the work of the EPA. Controlling indoor air pollution. Yes, the EPA is that is their core responsibility, so that the air that we breathe is not made of it's not having dust, it's not having poisonous gases in there that we take. So sometimes when you tune into the radio in your car or watch television, they are giving you, sometimes they even mention the air quality that for the day. They tell you whether it's dusty or is the dust particle is at a minimum. They give you that information. Where are they getting this figure? They're getting it from the EPA and then the rest. Developing and enforcing pesticide regulation. Chemical to kill pests. Pesticide. So they have to make sure that chemical is safe after the pest is killed and comes into contact with human being. Is it safe for the human being? They have to make sure that they regulate that. You don't just put in any chemical and then you end up killing people. And even if a chemical is supposed to have a negative effect on human being, it has to be indicated on the labeling, on the instructions, on the IFU, so that if you read, you know how to take preventive measures so that you don't get infected. Important acts administered by EPA: Federal Insecticide, Fungicide, and Rodenticide Act. So this is an act that is passed by the Environmental Protection Agency. Federal Insecticide, Fungicide, and Rodenticide Act. So insects, fungus, and rodents. So these are all the side to insects, chemical to kill insects, chemical to take care or to kill fungus, and then chemical to kill rodents. An act was passed or made by EPA to help make sure that all these classes of insects, fungus, and rodents, when the chemicals are used on them, it will not have any long-lasting effect on the human being and the environment. The environment will still be safe. We will not breathe any poisonous chemicals because of the application of those pesticide, rodenticide, and then the fungicides. All right. Then they also passed the 1990 Clean Air Act amendments. Clean Air Act amendment. That is why in I think in California, correct me if I'm wrong, they are trying to they give themselves up to a certain year that they will not have any cars that are in that state using gas. These petrol and the rest. They want it to be electric, so that there will not be any smoke coming from the exhaust of your car, so that the environment will be clean. And that was all. This Biden was a champion of that idea, what have you. And now Trump is on the neck of the EPA to stop that, because they want to drill more oil in America so that it will be cheaper for people to buy and use gasoline or gas cars. So in the green box, it says, somebody asked, what is greenhouse gases? Any of the gases that absorb solar radiation and responsible for greenhouse effects. including carbon dioxide, methane, ozone, and fluorocarbons. I'm not too much of a scientist, so some of them, maybe the science, Jawara, who is a science professor, will help us. I know. So basically, they're talking about gases that have some effect on a human being here. That's what they're talking about, basically talking about. And then the EPA will have a role to play because the environment, if it's safe for all of us. It's not safe for those who are working in the EPA. And some of the regulations they give, it helps. It helps a lot. All right. Okay, next slide, please. Any questions so far?
No question.
Okay, great. FIFRA is what? Does somebody know the meaning of FIFRA? Hello? Is there? Federal insecticide,
federal
fungicide,
insecticide.
and okay.
Yeah.
So it was one of the acts, the rules, the regulations that was passed by EPA. Okay. And we saw that the federal insecticide and all of that regulates the safety and effectiveness of pesticide, disinfectants, sanitizers, and ethylene oxide. Ethylene oxide is used in the CSPD department. I've never worked in a hospital that uses that, but the little that I know is that it has a very bad odor. It has a very strong odor. Yeah, the scent is very, very strong. I've never used that. That's all that I can tell you. It had a very strong. So EPA would indicate to you, and when there is that ethylene oxide is in the atmosphere, is so concentrated, they have alarms that go off telling you that that is there. So it means that you need to remove yourself from that environment so that you don't get infected. Does that make sense? So when you eventually get to, and most of these ethylene oxide are used in hospitals where they have cancer. They do a lot of cancer cases. So if hospital that I can immediately remember is Memorial Sloan. If you go to Memorial Sloan, I'm sure they might have they might be using ETO there. Data, does that ring a bell? Do you know anything like that?
Yeah.
Okay, good. Mm-hmm. Yeah. So when you work in a hospital where they use ETO, you have to be very mindful. You have to pay attention. When that alarm goes, you have to take yourself out of that environment so that you don't harm yourself and then harm your family members. Okay. EPA approved product labels must include product ingredients. If you are using, if you have manufactured any product that you use to kill insects, fungicides, and rodents, you have to, the product has to have indicate the ingredients you are using. It must show the manual, which is IFU or direction for use, and then the precautions, what you should do and what you should not do, and how to store it. And since it is harmful to the environment or some factors in the environment, you also have to show us how to dispose of the container or whatever is remain of the chemical that is not what used. And it must also have an EPA registration number. Okay. All of these additional information, yes, we need to know them. It must also show have expiration date so that if it is expired, then you must follow the guidelines to dispose it of. Okay. Next slide, please. Jawara, okay, let me take this one. The next one, Jawara, you choose some. Tawfiq will choose somebody. Occupational Safety and Health Administration, OSHA. Occupational Safety and Health Administration. So Tawfiq, be thinking of somebody you choose for the next slide. So OSHA, we saw OSHA yesterday when we're looking at entities or professional bodies that wrote guidelines concerning point of use or training of employees that handle or people that handle contaminated instruments in the healthcare setting. We saw OSHA yesterday. OSHA is basically on the side of the worker. It's not on the side of the employer. And the main reason why OSHA comes in is the safety of the employer or the employee, the worker. So OSHA, created in 1971 under the U.S. Department of Labor, protect workers from occupational illness and injury. So once an injury is reported, serious injury that cause permanent impairment or led to death, OSHA will come prominent into the show. Okay, and they'll come and investigate, and if they investigate and collect their statements and data and what have you, they can make recommendations as to how such injuries will be reduced or avoided completely. So key regulations: occupational exposure to bloodborne pathogens standard. So they have written how to deal with or how to protect ourselves so that we will not be exposed to bloodborne pathogens. Okay, bloodborne pathogens. They have written that. They have also written guidelines for the use of ethylene oxide sterilization, which I told you is the odor is. I understand. I've not experienced it, so don't ask me how it smells. But I understand it smells bad, and most of the time is used in cancer, where they treat cancer patients a lot. That's where you find that form of sterilization. General Duty Clause of Occupational Safety and Health Act. So they also wrote on the Occupational Safety and then Health Act. Inspection and penalties. So if they go to, there's an injury and they go to a place whereby they find the employer as being responsible for the injury, then they make recommendation, they make fines, and then they ask you to make corrective actions. And if you don't make those corrective actions and then it happens again, then they either double or triple the fine, or in some cases shut you down depending on the gravity of the injury that happens after their visitation. So we see that you say announced and unannounced inspection. So they come. So it doesn't necessarily have to be an injury happens. So they can come when an injury happens, or they can come when there's no any reported injury in place. Then penalties for violation range from $1,000 to $70,000. $1,000 to $70,000. So you could be fined within that range. And it says a repeat and failure to abate violation incur higher penalties. Yes, that's what I just said. So if they come and then you see that you have something in place that is a health hazard, or sorry, that is an occupational hazard. It is something that could lead to injury. It is something that is evident that for sure this will cause harm, and it does. And they come, they tell you, and you didn't take it, and indeed it happens. Then when they come, they give, you could be paying between $1,000 and $70,000. And if they ask you to remove it and you don't do it, they'll go, and one day they could demonstrably come back, not informing you, come, and if the situation is still like that, they triple or quadruple your fine. And I don't think you want to be working for OSHA. Next slide. All right, Tawfiq, get me a candidate, quick.
Ibrahim, can you help us?
Yeah, I can do that.
Okay, good. Thank you, Ibrahim.
Thank you.
All right, Centers for Medicare and Medicaid Services, CMS. CMS overview. The Center for the Centers for Medicare and Medicaid Services, to bracket CMS, operates under the U.S. Department of Health and Human Services, responsible for Medicare and Medicaid and the state's children's health insurance program.
Okay.
And then, should I proceed?
Yes, go ahead.
Okay. HIPAA standards. Establish national standards to protect patients' medical records. Administer standard for healthcare facilities.
Okay. So hold on there. So Centers for Medicare and Medicaid Services. I think there's no any American. If you come to America and within 6 months you have not heard of Medicare and Medicaid, then you probably didn't land in America yet. You always hear that. Okay. So these work under the auspices of Department of Health and Human Services, like Ibrahim read. Okay, they provide services for the aged, the poor, and then the weak or the frail or the children. Okay, so Medicare is for senior citizens, Medicaid is for low-income people, and then children, state and children programs, they can either fall under Medicaid or what? Medicare. Okay, so these are healthcare services or some that they provide to a wide range of people under different categories. Yes. Then it says HIPAA standard. So Centers for Medicaid and Medicare Services establish national standards to protect patient medical records. Okay. HIPAA standard. HIPAA make sure that you cannot let or expose patient medical record to the public. Not everybody is supposed to see somebody's medical record. It's a HIPAA violation. HIPAA is an act that was passed in Congress. They have a standard that all hospitals or facilities will have to follow. So if you are working in CSPD and you find in a tray a medical record of a patient that the trays or the instrument were used on, you are not supposed to disseminate the information. You are supposed to shred it right away. You are not supposed to take it home. You're not supposed to show it to anybody. Just shred it. Okay, so they make sure that information or records of patients are not publicly shared. Administer standards for healthcare facilities. So they make standards for healthcare facilities. You can't, like one of it is what we just saw. All right. Not everybody has access to medical information. Even if you work in a hospital, you don't have access to the information. And if you do, you have to make sure that you use the information for the purpose for which it is intended. Okay? You can't even, sometimes they tell you when you come to the hospital, you cannot be talking about the patient in the elevator. You cannot discuss anything about the patient in your private conversations. Just forget about that. Because if you do and the Lord catches you, my friend, my sister, my brother, you won't have it easy. So HIPAA violations are very, very serious. And whatever the recommendations, their guidelines, their standards are to be taken with the seriousness they deserve. Then Centers for Medicare and Medicare Services, they conduct surveys. So surveys both announced and unannounced. Okay, announced and unannounced, just like OSHA. They can come without informing you. They can show up by giving you a heads up that, hey, next month we are coming so and so day, so that you, if they give you announce, you can put your house in order. If they don't give you, they don't announce, You just be sitting there, they come and then they see all the raw deals you have been doing over there. And you will not be happy. Survey hospitals, long-term care facilities, ambulatory care surgeries, all right, and laboratories. So they go to long-term care facilities, they go to ambulatory care centers, they go to laboratories to see what is going on, how are patients' samples treated, like, are they just mixing it and giving false results or like that? And then, I don't know how, like, sometimes people go do all manner of Medicare fraud and what have you, charging people for, and then they go there and they check the books and then they catch them. People go to prison for 25 years and 50 years and what have you, and they even restitute, they pay back the money they took from consequences of non-compliance. Loss of federal funding, including Medicare and Medicaid payments. The hospitals, the healthcare facilities, they get a chunk of their income is coming from Medicaid and Medicare, because very few people come with private insurance or very few people come to the hospital seeking care that they pay out of pocket. So a lot of the people who come there are covered by Medicaid or Medicare. So if you lose your credentials, your approval with Centers for Medicaid and Medicare, or Medicare and Medicaid, because you are not in compliance, then it means that you are going to be running a business on a loss, because a chunk of the patients who walk into the health facilities are under this kind of medical insurance or service. State, yes. Now I took over, right? Ibrahim, I'm doing your job.
No worries, keep on.
Okay, no problem. So you finish up the green one for me.
All right, Medicare.
Mm-hmm.
A federal medical insurance program that primarily serves those over age 65 and of age, regardless of income, and people under 65 with certain disabilities, and people of all ages and end stage. I think I can see it now.
End stage renal disease. So if you have kidney problems, you have liver problems, yes, regardless of your age, regardless of your income, Medicare will take care of you. Okay, will come to your aid. So Medicare is for senior citizens, 65 years and above. Okay, they enroll. Sometimes you get a certain age, it's automatic enrollment. Some of us are approaching there. All right. Sometimes you get mails from your text messages or emails, your inbox, and then it tells you all of that. Okay. So if you have renal diseases, regardless of your age, you could be enrolled on Medicare, because it's a long-term something. You're going to be for a while. Nobody want to be that. We pray nobody gets there. Then Medicaid. Mm-hmm.
All right, Medicaid. A federal and state assistance program that pays covered medical expenses for low-income individuals.
So,
it is run by state,
yes,
local government.
Okay, so Medicaid is basically for the poor people. That's what it is. Medicaid is for poor people. Period. Just take it like that. Next one, the other point.
All right, we have Health Insurance Portability and Accountability Act.
Okay.
HIPAA privacy rules provide federal protection for individually identifiable health information held by covered entities and their business associates. And business associates. And give patients an array of rights with respect to that information. www.
Okay, right. So the patient has right over his record. You cannot just do anything with the patient information because you are a doctor, because you are the nurse who provided care, who provides service. No, because of this HIPAA regulation, the patient has an array of right. Okay. Not even sometimes you maybe a father because you're a child, or maybe a husband. Sometimes you don't even have you don't have access to your wife's health information. Likewise, your wife is, unless you have gotten to a point whereby you can't make a decision for yourself. That is when your wife or your husband come in to have that information. Okay, so HIPAA is a very, very serious issue. And when you get into the hospital system and you get any patient information, you have to treat it with the best attention that you can ever get. Yep, next slide, please. All right. Ibrahim, you want to choose somebody, or let me do this one? Then you think about who you choose the next slide. Okay.
All right.
All right. So, Association for the Advancement of Medical Instrumentation. We saw that yesterday. This is another professional body that also wrote some guidelines that help in training people and that help how to handle instrumentation or process or sterilized instrumentation. So, AMI, founded in 1967. These are all history. I don't think we'll be asking you any question like that. Non-profit voluntary consensus organization. It's non-profit, it's voluntary. Their guidelines are voluntary, but they are best practices. Okay. Membership includes healthcare technology professionals like you and I. Okay. If you get into the business or into the healthcare system, you could make that be part of this membership if you go through their requirements. Committees and work groups research and develop new standard and technical information reports. So they research, they develop new standard. So day in, day out, people are working. People are not sleeping. They are always working. That is why in CSPD, when you come, we have what we call continuous education. CE, continuous education. You always need that for recertification of your certificate. All right? Because every day something new is coming. Either a new instrument is coming, a new standard is being written. So you always have to be abreast with events happening in the industry. So they research, they develop new standard, and then technical information reports. Revise existing standard and technical information reports. So they revise new ones. If they see that they have outlived their usefulness, they revise them. And then they can also write new ones. Develop standards for what? Manufacturers. So they write for us as workers, and then they write for the manufacturer too. They make recommendation to the manufacturer too. So it's a two-edged sword, cut here, right? Publications and impact. Publishes many standards and technical information reports. Functions affecting CSPD department or CS department include cleaning, sterilization, packaging, equipment, testing. All right. So, for example, there is most of our basic instruments have testing devices to let us know that the instrument is functioning properly. Scissors have testing materials that when you are putting trays or instruments together, you use the scissors to cut that material to test whether the scissors is sharp or not. If you are using a puncture, you have an index card that you bite it to see whether it will cut clean. That means that it is sharp. If it's going to cut any tissue whilst the surgery is going on, it's going to cut without causing any serious damage to the tissue. Okay, so instruments are tested. These recommendations are made by these professional bodies. All right. Next slide. Ibrahim, get me somebody.
Tania.
American National Standards Institute.
Okay.
Founded in 1918, primary mission to enhance global competitiveness of U.S. business, promote and facilitate voluntarily consensuous standards, ensure integrity of standards.
Okay, pause there. So the ANSI was basically formed to enhance or to put America on the global stage in terms of what? In terms of standards, okay, to make sure that America is highly competitive in the world market. Okay, that was the primary goal of what? America National Standard, making sure that whatever we put out there is always number one. If anybody overtakes us, then we need to go back to the drawing board to make sure that we take back our spot. So that was the goal, the primary goal of ANSI, to promote facility and facilitate voluntary consensus standards. Yes, they also write guidelines, but guidelines are not what? Legal. They are not binding, but they are good practices. If we do that, it will help. Ensure integrity of what? Standards. Yes, the next, read the next one.
Represents interests of over 125,000
companies
and 3.5 million individuals.
Yes. So that is how big it is. 125,000 companies and 3.5 million individuals.
Does not develop American standards, provides a neutral arena for agreement.
Continue.
Committee membership similar to AAMMI.
Okay, so committee members similar to AMI means that we have its professional bodies which are in there, that technical or professional bodies that are individuals who have expertise in certain areas that come together to write those standards. That's what it's all talking about. Yeah. So their standards are submitted to NC for what? Approval. Examples include.
Examples include standards developed by AAMI.
Yeah. Okay.
U.S. representative to the International Standards Organization.
Okay, so that's on a different slide. So just as AMI advanced, AMI has membership or the professional bodies that come together to form AMI to make recommendation, the ANSI also has professional bodies or individuals with expertise or expert knowledge who also come together to write that. Yep. You continue with this slide before you. I'll let you rest. Yes.
Association of Preoperative Registered Nurses.
Okay.
Professional organization consists of preoperative nurses and others dedicated to providing optimal care to surgical patients.
So this organization is basically made up of nurses who work in the operating room. That's all it's talking about. So association of nurses who work in the operating room come together to make some recommendations, some guidelines, and write out some standards or guidelines to help make sure that surgeries are done safe and convenient. All right. So if you are a nurse who is working in emergency, you cannot write something about perioperative because you don't know what goes on there. If you are a nurse who work in a maybe a primary care doctor's office, you have no idea of what is going on in the operating room. So you cannot make any contribution regarding that. It has to be somebody who has an experience with the operating room situation who can be part of this one. Yes, go.
Committees and standards comprised of AORN members and allied association members.
Okay.
Develop nationally recognized evidence-based standards. Guidelines include cleaning, disinfection, packaging, endoscope processing, and sterilization.
Yes. So these nurses work in there It says members and allied association members. Okay, so they work in there. So somebody may work in a OR, somebody may work in labor and delivery. They are also surgery, because surgery goes on there. Okay, somebody may also work in emergency where they do surgical instruments. Okay, sometimes the OR is able to make some recommendations. Say, hey, we saw this in this tray. If we do it this way, it will help. Okay, we as managers, or sometimes the managers, the directors, they take input from the OR, and then we factor in it in our daily routines, and then we get the work going. So even though within our local settings, we take these recommendations from the OR. Imagine when there is an evidence base, there's enough data to prove that what they are saying is true. Then it becomes, they take it to a higher level. It can become a state guideline, and then it can eventually become a national guideline. And this professional association does that. Yes, go continue.
Standards and review cycle. Standards reprinted annually. Most standards on the 5-year review cycle.
Yeah, so it means that whatever recommendations they have made, 5 years down the line, they go back and review, sit down, digest it, see, is it still worth practicing that, or let's modify? Yeah, continue.
Regulatory compliance, not a regulatory agency.
Yeah, so their guidelines are not legally binding, but it is best practice. Next slide. Okay. Who just read for me?
Shania.
Shania. Oh, can you choose somebody for me?
Sure. Let's see. Zanab.
Let's see those who put on their phones and go and sleep. Maybe Zanab is one of them. Zanab, are you?
I'm not one of them. Please, I'm in a very noisy environment, so maybe you can pick someone else. Yeah.
Okay,
sorry.
okay. So she gave an excuse. So we'll take it. Yep.
Jamal.
Okay, you'll be thinking for another person. Let me take this one so that he will come in the next slide. Association for Professionals in Infection Control and Epidemiology. Yeah. So EPIC review, it says voluntary international organization. So it's voluntary, it's not binding, nothing of this. Their guidelines, their standard is good practice, it's not binding, it's not legal. You break them, you don't get this in bed. It will help if you don't break them. Okay. Members work to prevent HAIs in healthcare. Who knows the meaning of HAIs?
Healthcare associated infections.
Fantastic. All right. So they make sure that if you go to the hospital, you don't go back worse than you came. All right. That is their job. Okay. What is this the agency responsible for? Works with CDC to adopt infections to disease prevention standards. So they work hand in hand with CDC. Examples include bioterrorist readiness plan and guidelines for infection prevention and control in flexible endoscopes. So they work with CDC to make sure that if there is a bioterrorist attack, what are the things that we need to do so that people will be safe. They also write guidelines on infection prevention and control in flexible endoscope. Flexible endoscopes are medical devices that are used to examine the internal organs that go through that have some camera-like device on them that is able to visualize the internal being of a human being, either the stomach or whatever they want to see, or reproductive part of the human being, the intestines, wherever they want to see. They put that endoscopic there. We have some that goes through the mouth. We have some that goes through the behind and what have you. So when you get there, you get to know all of this. Okay. So they give guidelines as to how to make sure that the device is clean and disinfected, such that when it is used on one, if the person will not get more infected than before. All right. Then it also says that role of CS technician, what do we do with regards to these people's standards or guidelines or advice? They say interact with infection preventionists during department one survey. So when infection control comes, infection control is always there when it comes to things like this. When they come, you interact them, you ask questions, they talk, you ask questions. Where you don't understand, you ask for clarity, you ask for deeper explanation, so that, because our job is such that you cannot second guess, you cannot guess. I always tell people who come that it is so embarrassing to be told that you killed somebody or you made a mistake that harmed somebody, than just asking a simple question and you get the right information and you do the right thing. So always, when you get opportunity to work in any facility and you are confused, ask. It's a teamwork. Ask your colleagues. Those who know it, who are more experienced, will tell you what to do. Don't guess. If you guess, you either harm yourself or you kill somebody. All right? Infection prevention is responsibility. Collect, analyze health data related to hospital-acquired infections and employee health. So he analyzes that and sees what is the way to go. All right, next slide. Shania, have you got somebody now?
Yes, Jamil.
Is he on the line?
Yeah, right here.
Okay, go, my brother. Let's go.
International Standards Organization.
Yes.
ISO overview. Non-government organization with a network of natural standards institutes. Represents 103 countries.
Okay.
Purpose of ISO standards. Provide states of the art specifications for products, services, and good practices. It helps make the industry more efficient and effective. Voluntary nature of ISO standards. No legal enforcement authority. Adopted by some countries or referred to in legislation.
Okay.
ISO standards proposal and certification. Proposed by members and granted based on
consensus.
Yeah. Growing trend in the healthcare industry to become ISO certified.
Okay. So International Standard Organization, ISO is made up of 63 member countries. Okay. They provide state-of-the-art specification for products, services, and good practices. So their goal is to make sure that whatever product you're selling is top-notch, the best. You cannot give substandard stuff. All right. The services, if it's a service you are providing, top-notch. If it is a good product, top-notch. Okay. And then they might make sure that beside that good, you must practice good. You must practice good distance. You must put into place good practices as well, and help the industry to be more efficient and effective. Now, their regulations, their standards, their recommendations are not binding. They are voluntary. Take it or leave it. But the advice is always follow the recommendation. You don't lose anything at all. You lose anything. If you have so much information, it's good for you, it's not bad for you. Okay. And then now you say the recommendation is that a lot of hospitals are trying to make sure that they have an ISO certification so that you can use that to brag. That will make their resume look good. That, oh, I'm a hospital that have an ISO certified, or I'm certified by ISO. So it means that my services are top notch. The product I use are top notch. So bring your families there and you have your peace of mind. That is the growing trend now. Everybody wants to use ISO certification as a resume on their resume to get more patients to come in. Next slide, please. Joint Commission. Joint Commission is role and function of Joint Commission. Private, independent, non-profit organization develop standards for healthcare facilities. Every 3 years, every hospital encounter this particular entity or organization. And when they are coming, Professor Japon and director and myself, everybody is terrified. I don't know why, but I'm sure the three of us know why. Everybody is terrified. And when you get into the healthcare industry, you will see what I'm talking about. When they are coming, people call out sick, people dodge, people take vacations because they ask people questions on the spot, and then people don't want to be embarrassed and all of that. But every 3 years, it happens. Okay? So they write standards, and if they come, you don't pass, you can lose your patient or Medicaid, Medicare services, because that is your livelihood as a hospital. That is where you get your money. If you lose that, you are out of business. So evaluation process, on-site survey every 3 years. Sometimes unannounced. When they like you, they tell you, okay, we are coming. So survey, Joint Commission survey is always done every 3 years. Okay. If it is not hospital A, hospital B will be doing survey. Okay. So it happens every 3 years. They come on site, they check everything from security to the operating room. Everything, food, everything is checked. You can't cut corners. If you cut corners, you're in trouble. All right. Importance of accreditation, recognition for quality practice. If you pass, then thumbs up. You can hit your chest and say, yes, I passed Joint Commission. So bring your family. Good care be taken. Non-compliance may lead to loss of what? Accreditation. So they find citations, a lot of wrongdoings, a lot of cutting corners. You lose your accreditation for Joint Commission, put a red flag on you. They'll blow you out of proportion. Sometimes they say to come in and then shut you down. All right. Then potential for future of Medicare and Medicaid payments. And no hospital in America can survive without Medicare and Medicaid. It's not possible because the rich people just form 1% of the population. So 99% of us either fall under Medicaid or Medicare or some form of maybe private insurance. So if they take that payment method away, then you better convert your hospital into an apartment building so that you can survive. All right. So Joint Commission is very, very important. Okay. What has Joint Commission got to do with CS department? Technicians' responsibility, continuous quality improvement. So once they come, whatever they notice is and the recommendations they will make. At the end of the day, they submit a report. That report, higher-ups and our managers get that report, and then each department gets their recommendations that were made, and then they bring that report. The managers come down and discuss those reports with the technicians on the floor. Okay, so you get to know what you are doing right, and you get to know what you are doing wrong. And then based on that, you see areas that needs improvement, and then we work on that. Next slide. National Fire Protection Association. And the national organization works to reduce fire and hazard burdens globally. Members represent nearly 100 nations and organizations. So fire department, I think every country should have that. Development of codes and standards. So they develop codes. They uses of what? Consensus process. So it is not binding. It's also a voluntary organization or entity. Their job is always influencing building safety in U.S. and other countries. Okay, U.S. and other countries. Almost every day, the fire people are we ready to go and quench some fire somewhere. So they advise on how to put up the structure in the first place, so that it will not be prone to outbreak of what? Fire. So every one of them have a role to play, because in Central Star, we have chemicals that could catch fire. So they'll train you how to deal with that. And if there's a fire, how to evacuate and all of that. It's very important. CSPD, fire safety standard for buildings. Address fire burden of disposable package items. Yes. You know that alcohol can catch fire, right?
Yes.
Yes.
Yeah.
Yes, alcohol can catch fire. And in CSPD, we work with alcohol. Okay, either a decontamination room, decontamination area, or clean assembly area. So we have to make sure that it is kept in a place whereby when there's a fire, it will not be a catalyst to the fire. It will not be a motivating factor for the fire to expand and explode. All right. So they also give us these standards that we work with. All right. Surgical drapes, gauze sponges, and then what? Patient drapes are all potential catalysts for what? Fire. When fire catches those consumables, the base become big and it's become difficult to control. So they also make recommendations for us and or for hospitals. Next slide, please. United States United States Pharmacopedia National Formulary. I think Pharmacopoeia. I think the E should be a D. Maybe it's a typo error. I'm not very sure, but I think it's a Pharmacopoeia from a national formulary. It's about food and ingredients that come into that. So it says create and revises standards for purity of what? Medicines. So their Pharmacopoeia is pharmacy. Is basically talking about pharmacy. And what is the role of the pharmacy? They distribute medicines and food products for infants and the rest, right? Or the very, very aged people who their digestive system cannot maybe digest anything, or they have some bypass of any sort because of surgery. So create and revise standard for purity of what? Medicines, include drug substances, and then dietary supplements. Publication standards published in U.S. United States Pharmacopedia Formulary. So they write standards to this association. They also write standard that need to be followed. Packaging, labeling. So the packaging, how to label it, It must show us the ingredient, the expiration date, how it is supposed to be used. The IFU must be clear. All right. So, like if you take your liquid medicines, those of us who have kids on this line, sometimes you get the liquid medicine for the children. They say shake it, and then you measure a certain milliliters of the content, and then you dispense it or give it to the child or the person to take. So, but I say bacteriological purity, pH, and mineral content. All right, it must be also spelled out. Important, essential for Central Cell Processing Department working with purified or sterilizing water. I am yet to see where we do that, maybe, but I want to believe that it is done. But I have not come into contact with where we sterilize water. But I want to believe that for it to be in a course book, there are hospitals whereby they do that. All right. I know some hospitals sterilize linen, some hospitals don't. Okay. So if water has to be sterilized at CSPD, then we have to follow the guidelines of this USP-NF. Okay. World Health Organization. Again, they were all over the place when COVID came. And when there's any disease outbreak, World Health Organization, that is when they become so active. Now that COVID has become part of our life, they have gone to sleep. So established in 1948, Agency of the United Nations, focused on international cooperation in health. So their standards or regulations cut across boundaries, continents, states. It's all over the place. So in Europe, Africa, the Americas, the Latin America, the North America, everything issued by World Health Organization, we have to follow. And that is one of the things that our president said he's going to take us out. I'm not a politician, but that's what he says. We don't have to listen to what World Health Organization is doing or is telling us. Major tasks: combat infectious disease. Their role is to combat diseases that are infectious. And some of these diseases, sometimes they happen maybe every decade, every century, every 50 years, there's something strange happens. Boom. Then the world is at a standstill, right? When that happens, then World Health Organization is activated, and then they try to write certain policies, certain standards, certain regulations for us to follow. All right. Promote general health worldwide. It's their job to make sure that we live healthy across the globe, so that we are free to travel and mingle, so that you are not restricted because of a certain condition in your country. Coordinate efforts. Monitor outbreak of diseases like SARS, that is COVID, malaria, common in Africa, AIDS across the globe, and CJD. Oh my God, CJD is here. So they coordinate that to make sure that there's no outbreak of CJD. CJD is very, very dangerous. Very, very, very dangerous. Okay. Then research and standard. Provide central clearinghouse for research services. So they are constantly working, researching into how to take care of outbreaks, how to make sure that certain things don't even happen in the first place. And if they do, what are the mitigating factors that we can use to control such outbreaks? They are always doing what? Research. Somebody was, there were a lot of theories that, oh, okay, this COVID after all was a lab something. I don't know how far that is true. There were a lot of theories in there where that were thrown into the system. Maybe it could be true that out of some research it happened. It could also be a fallacy of some sort. So World Health Organization is always conducting research and then making sure that their research work is what? Used for humanity. Make sure that it's used to make sure the human being is safe from infectious disease. Set international standard followed by agencies like CDC. So CDC taps World Health Organization because if you look at the pyramid, World Health Organization will be at the top. Every disease Center for Disease Control of every country, regardless of how they are named in various countries, will fall under the umbrella of World Health Organization. Is for the whole globe. So their standard is well recognized. Next slide.
Professor John, let me add that we are aware that it's 6 o'clock, but we have only 4 slides after this one to go. Please bear with us, okay? Only 3 more slides after this one.
Yeah, I wanted to make sure that to say that. Thank you, Director. Unfortunately, just bear with us so that we can just finish the chapter so that we know that we're done with it. Society for Gastroenterology Nurses and Associates. Gastro means goes through your gastro system, your mouth, into your internal organs and what have you. Okay, so those in the healthcare sector, we have specialization. Some people work with the heart, some people work with the intestines, some people work with the reproductive organs. So everybody, some people have with the ears, some people work with the eyes. So those who are expert in gastroenterology, the nurses, they come together and write standards that relate to endoscopes that we use to visualize what is happening in the human being, and for that matter, how to reprocess such endoscopes. Yes. Why me? Sorry, come and take care of it. Okay. So these agencies deal with that. All right. Sorry, I got a visitor. Okay. So they dedicated to safe and effective practices of gastroenterology and endoscopy nursing. That is their main function. They collect, they establish standard and guidelines for flexible endoscope processing. So because they use the endoscopes, flexible endoscopes, which they use to see what is going on in the patient, and then therefore provide treatment, they are able to advise CSPD or write some recommendations that will help us process these endoscopes. So their recommendation is also very, very important. When you begin to work in the healthcare setting, you will notice that you will deal with these endoscopes. They have a whole lot that you will come into contact. All right. Some of them is just disinfectants you have to use. Some of them is you have to sterilize it through low temperature sterilization that you will see later in the chapter as we go along. So they also give advice. And then we need to take their advice also. Though it is not binding, it's very helpful. All right. They have published in 2013 and also in 2012, they have some publications that they made. Okay. And these publications are in existence. They go to review them and keep certain portions and add certain things as they practice more and more. And these reviews must be evidence-based. It must not just come out of the blue. They must have data to prove it. That is when they revise these guidelines. Next slide, please. Canadian Standards Association. Yes, Canadian Standard Association. Unfortunately, when I took the test, this was not part of it, but now they have reviewed, they see that there's a need to add this. So you see that review is very, very important. So it's a non-profit organization that also develops standards for various sectors, serves industry, government, and healthcare. So Canadian Standards Association. Okay, they also develop standards that is used across healthcare setting. They also industry setting, government setting is there, is used. Their recommendation is not binding, but good practice. Standard applicable across all provinces. In Canada, so this is Canada. Because Central Service is an international career, it cut across. So what is happening in Canada is what is being reported. In Canada, like we call states, they call it provinces. Okay, yeah, that's why you see the province. Surgical instrumentation developed many standards for reprocessing. So Canada, they have manufacturers or standard that they write regarding how to reprocess either our basic instruments or endoscopes that we, or flexible scopes or rigid scopes that we deal with. All these things sounds strange, but when you are fortunate and you pay attention to what we are doing and you pass the exam and you are hired in a healthcare facility, you see that what I'm saying, what the director is saying, what Professor Japon is saying, what Professor Mike is saying is so practical. You see it. A Ghanaian man will say, feely. You see it, feely. Easy. It will be easy. It will be meaningful to you. But for now, we are just talking. It looks well abstract, but it will become practical very well. So you can get more information from that website they put there. So if you go there, you can get a lot of information regarding Canadian one. European Committee for Standardization. So this is a committee restricted to the continent of what? Europe. But that is not to say that their recommendations cannot be practiced in America. We can still practice their recommendations in America. Okay, the fact that it is in Europe, and like I said, central sterile processing, before it used to be international Asian. It used to be Asian, which is international. Okay, though the name has changed, it's still international. So since Europe is part of the globe, then whatever goes on in Europe that are best practices can be practiced here. So what is the role of what? European Committee for Standardization. Set standard for Europe. But we can use it here, like I said. Similar to AMI in the US. So their role is similar to AMI. Members, countries, about 33 countries in Europe come together to form the European Committee for Standardization. So they want to make sure that what they are doing is across the board, is standardized, it's uniform across Europe. Okay. Then adopted same standard exclusively. Then what is the important impact in US companies? Must follow same standards for products sold in Europe. So it means that if you are a manufacturer in the United States and you want to sell your product in Europe, then you must meet European Committee for Standardization requirements. That's what that statement is talking about. Must follow same standards for product sold in Europe. Applies to instrument processing products. Applies, yep. So all these things that we have spoken about, all these 3 hours that I'm keeping you, this is how we concluded. Standards and regulations is to ensure safety for patients and employees. The goal of standards and regulation is to keep the worker safe, is to keep the patient safe. What is your role as central sterile technician in this safety protocol? One is to familiarize yourself with relevant agencies and organizations. So you must know that FDA is the one who gives approval for medical devices to be sold. And then they classify medical devices into class 1, 2, 3, and the risk of medical devices are also classified as risk 1, 2, 3. They can recall devices, and their standards must be followed, and their standards are mandatory. Once they made a recall, you have to obey. It's not voluntary. And you have to also have to familiarize yourself with the fact that if you are working in a hospital setting, HIPAA regulations must be followed. You cannot put patient information in open view, public view, because sometimes patient information you put in there, you can know the disease the person is suffering from. You can get some social security information in there. All right. So you must familiarize yourself with these agencies that you have: CDC, EPA, AMI, AON, ISO, and all of them that you can think of. World Health Organization, all of those agencies, you have to familiarize yourself. But I can promise you that as for FDA, you will get at least 2 questions over there. There's no way about that, right? Then stay updated. Why is this all important to the CSPD technician? You stay updated with changes in requirements. As they review, we saw that some of them review semi-annually. Some of them review every 5 years. Some of them review 2 years. Some of them review maybe weekly. They collect data here and there, analyze, make updates, make revisions here and there. We need to be updated so that we are always on top of what we are doing. And finally, what are the benefits of complying? What are the benefits? If you obey mandatory ones or you obey non-mandatory ones, what are the benefits? Create a safe environment. Promote what? Competency. You become a master of what you are doing. Right? You become a master of what you're doing. So this, in conclusion, is what standards and regulation is all about. I want to, on this note, apologize for keeping you for the next 30 minutes. I want to use this opportunity to hand over to the director if he has any words to add before we all walk out. Thank you so much for listening.
Thank you so much, Professor John. We've already taken your time. I know some of you have other commitments somewhere. We will not take any more time. So just go do your quizzes and practices. We shouldn't have any problem with chapter 6 and 7. I know because of the order of the book, yesterday we did 7 and today we did 6. So if you have already attempted doing 6, because I saw 4 people already tried, just check again to see what update was done. Our IT team are working hard to resolving any issues. So by the time we get to the middle of this session, we shouldn't have any issues with old version, new version. Thank you so much. See you next week.
Thank you.
Thank you.
Have a good night.
Thank you, Professor.